Now, Teicholz, the present guidelines, the 2015 U.S. dietary guidelines, those are the guidelines that are presently in force, and those are the guidelines that are being that are presently being popularized. And would you be able to say to Madam Chair something about the 2015 guidelines and what the effect is?
Certainly. Yes, I think this is an important question because for anybody following the literature, one wonders, where was the consideration of these clinical trials, a large number of clinical trials in the last U.S. dietary guidelines? And if you go to the expert report of the dietary guidelines, you find that it says that only limited evidence is available to address the relationship between low carbohydrate diets and health. This seems extremely odd to me. So a journalist friend of mine did a Freedom of Information Act requested the Health and Human Services emails from the Dietary Guideline Committee, discovered that they did, in fact, conduct a review. NEL stands for Nutrition Evidence Library, which is the office at the U.S. Department of Agriculture that conducts systematic reviews. They did conduct a review on low carbohydrate diets. And then there's a discussion about, well, we're going to put this in the methodology section of the report, where they clearly don't belong. And one of the Dietary Guideline Committee members objects. And he says, this is Frank Hu, Harvard professor, saying, I was wondering if we should have a separate section on low-carb diets rather than burying it in the methodology section. And we should not simply dismiss the role of low-carb diets in weight control and improving overall health outcomes. And he also mentions, I didn't put this in bold, given the enormous, not just the popularity, but the enormous amount of research that has been generated in the past several years. Acknowledging that that research exists, that it should have been part of the report, but it was not. I think this gets directly to the question of whether the U.S. dietary guidelines are the gold standard that we consider them to be. They are the kind of mother lode of all of our conventional wisdom. So we've just discovered that the low carbohydrate literature, scientific literature, was ignored. I did a rather thorough investigation of the expert report by the 2015 Dietary Guideline Expert Committee, and all 450 pages of it. And I came to some conclusions that were published in the British Medical Journal last year, and I came to some other disturbing conclusions, which is that a number of key scientific reviews, including the one on saturated fats and including the ones on the dietary patterns, which are the fundamental advice they're giving, had not been systematically conducted, which means to say they had not selected the evidence according to rigorous systematic procedure. They had kind of picked and chosen some studies that they knew about, if they knew about it, or if they, and they just didn't follow systematic methods, which means that the results are not reliable. I'll just run through a little bit of this evidence. So this just shows clinical trials that are included. So in the review of do saturated fats cause heart disease, what are the clinical trials that the dietary guideline committees have reviewed? That's in green, above the line. Below the line are all the clinical trials they've ignored. So in their reviews, they've looked at 2 small trials on 30 people, and they've ignored all the trials that we've discussed, all the trials that Dr. Harcombe reviewed and that I've reviewed. It just shows you that they just have ignored the data. Do the dietary patterns protect against heart disease? That was one of the systematic questions that they asked. They included one randomized controlled clinical trial to support that position, which they said was a strong body of evidence. That was one trial, and they ignored the Women's Health Initiative and 2 other studies. Do the dietary patterns help people lose weight? They found one clinical trial that supports that position on 180 people, and they ignored clinical trials on more than 50,000. Do the dietary patterns protect against diabetes? There are no clinical trials cited to support that claim, and there's one trial, the Women's Health Initiative, that was ignored. This is just a chart to show the dietary guidelines really have not changed from 2005 when they first started providing these actual amounts to today. They really haven't changed. So why should we expect different results, really? As Einstein, I believe, said, the definition of insanity is to do the same thing over and over and expect different results. It's also, I think, problematic for the dietary guidelines everywhere that there's not a range of diets. You know, there are different nutritional needs depending on age, gender, genetic background, metabolic health, and there's still simply, despite those 3 dietary patterns you saw, they all were virtually identical in terms of their macronutrient makeup. There's still virtually one diet for everyone, and that is, in my view, wrong, and is also wrong in the view of the National Academy of Sciences. When the dietary guidelines were launched in 1980, they had a report saying the board, referring to the National Academy of Sciences, considers it scientifically unsound to make a single, all-inclusive recommendation. Needs for energy and essential nutrients vary with age, sex, physiological state, hereditary factors, physical activity, and the state of health. The nutritional needs of the young growing infant are distinctly different than those of the inactive, and yet we still have a one-size-fits-all diet. This is just a different way of explaining it. Those are the 3 dietary patterns showing how similar they are. And this is that same chart again, just showing that the dietary patterns are same, also, same in terms of their macronutrient makeup. And I compare the 3 in blue is what's recommended today. In green is again the 1965 American diet and the real Mediterranean diet, which is a higher fat diet. The Mediterranean diet that has been tested in clinical trials is tested at 41 to 42% fat. So what you would call here a low carb, high fat diet is, again, that is the standard diet in the Mediterranean, and the diet tested in those Mediterranean trials showing the cardiovascular benefits in those trials.
Now, Ms. Teicholz, you did this analysis, and can you tell Madam Chair if this analysis had any impact, and what was the impact of the analysis?
Yes, Madam Chair, would be interested to know that the U.S. Congress is deeply concerned about obesity and diabetes in America. And they are deeply concerned about the dietary guidelines, and they had a hearing on that last October 7th, 2015, where they called in it's a very unusual hearing because 2 secretaries of 2 agencies that are jointly responsible for the dietary guidelines, U.S. Department of Agriculture and Health and Human Services, together came and testified for 2 hours before a full Senate committee, and they expressed high levels of concern about the science, about the process, about the use of whether or not reviews had been systematically done, about here's Peterson, the last quote. He said the guidelines have pushed people away from eggs, butter, and milk, and so forth. And then they come back and say, well, maybe we were wrong. There's a deep level of concern. I had the opportunity to go to Washington and meet with members of Congress because of my work that I had done, because of my article in the British Medical Journal and a report that I had done that preceded that. And it was extraordinary, the level of concern, and I know that my article was instrumental in helping to have them consider options for how things might be fixed. They know something is wrong with the dietary guidelines, but they're only approached by industry, people of industry, who comes to their offices are people, food company lobbyists. On the whole. And then the public interest groups are like the American Heart Association, and they're allies, and they have a position, and we know that they're sort of defenders of the diet-hard hypothesis. So I actually was the first person who had come to them who I have no connection to industry. I'm purely science-based. My only interest is in the public health. And I was literally the first person who had come to them who, from a non-interested position with a different point of view. And they were remarkably responsive. And as a result...
Page 259, Madam Chair.
At the end of 2015, they mandated the first ever major peer review by the National Academy of Medicine of the dietary guidelines, which is now underway. They allocated $1 million for that study to ensure that it happens. And they asked all the members of the 2015 Dietary Guideline Expert Committee to recuse themselves from the process.
Now, Ms. Teicholz, you make some comments about nutrition and politics and the relationship. And can you comment on that?
Yes. I think what I wanted to talk about a little bit about is just how nutrition politics today are very much the same. What we see is science still being silenced or ignored. I have up-to-date stories from scientists at universities across the U.S. telling me they can't get their papers published. Their paper was rejected because so-and-so in the Dietary Guideline Committee sits on the editorial board and got their paper rejected. Critics are not invited to expert panels. Ron Krauss, who did that very seminal, important study in 2010, the very first major review of saturated fats, he was disinvited from a panel. There's Yusuf Salim, an incredible, one of the leading scientists in Canada, was disinvited from a meeting because he has unconventional views about salt. I hear these stories all the time now, and I'm sort of I guess I'm a beacon for them now. And the tactics that worked for Ansel Keys are still being employed today. Those very specific tactics, calling people's work full of errors, telling them that they're motivated by industry or finances, and that they're not motivated by good science, and attacking any of their papers that came out. All of this is still common today. As I said, Procter & Gamble remains a major donor of the American Heart Association, as well as most of the medical professional societies. I mean, you could go on really forever about the influence of the food industry at the highest levels. There was just a story that came out the other day about how Coca-Cola had given millions of dollars to the Center for Disease Control, which is part of the U.S. government, as well as the American Heart Association. So I think I see little that has changed. And there is, I think, in the face of challenging science, there is a growing effort to try to stifle debate. I mean, what you see happening here with Professor Noakes is something that's happening around the world. What you see is people who are trying to present alternative views of the science are being punished for it. And part of that is that, so there's this True Health initiative. They have collected hundreds of scientists around the world to say, we agree. Their principle is there should be no debate. Science is settled. We're done. Which is like the antithesis of science. Science should never be done. But this is their platform. They're very well funded. And they have consensus conferences to come out with common ground, and where they try to come to a consensus. And the consensus is generally, we support the dietary guidelines, we support a diet that is high in grains and plant-based and generally low in fat. I've also, like Professor Noakes, had my own because I've been outspoken. That BMJ paper I told you about, there was a letter organized by an advocacy group rounding up 180 scientists asking for retraction of my article based on 11 alleged errors. The BMJ has announced that they are not retracting the paper. There may be one error, but we're still going back and forth over it. So certainly nothing that would merit a retraction request. And I myself had the honor of being disinvited from a food policy panel of a major national conference in Washington, D.C., because the other members of the panel was the woman in charge of the dietary guidelines at the U.S. Department of Agriculture and the woman in charge of this advocacy group that had tried to get my paper retracted. And they said when they heard, oh, and then a member of the dietary guideline expert committee whose report I had criticized, and the three of them all said, we will not serve on this panel if Nina's on the panel. So they called me up and politely disinvited me.